This presentation covers blood vessels of different kinds and how they work. Blood vessels are tubes that carry blood, and they are pressurized by the heart. They are not passive pipes. They have two very important functions. One is to control blood distribution, that is where blood goes in the body and when it goes there, and to regulate blood pressure. There are three major categories of blood vessels: arteries, veins, and capillaries. Arteries carry blood away from the heart, and you can remember that because arteries start with A and away starts with A. Veins return blood to the heart, and capillaries are the connection between arteries and veins, and they're the place where exchanges occur between the blood and the tissues. Let's look at the structure of blood vessels. Blood vessels have three layers. They are the tunica intima, the innermost layer, the tunica media, the middle layer, and tunica adventitia, the outermost layer. You can see these layers in the diagram to the right. You'll also be looking at these layers in lab. The tunica intima, the innermost layer, is a layer of endothelium. It's composed of simple squamous epithelium. It lines the entire circulatory system, and it is a low friction surface, which is exactly what you want. This will decrease the resistance of the blood that flows through it. The middle layer is the tunica media. It's composed mainly of smooth muscle, although it does contain some elastic fibers. The sympathetic nervous system controls this layer, and this layer is larger in arteries than it is in veins. The outermost layer is the tunica adventitia. It's composed of irregular, dense connective tissue, and its most important jobs are to protect the blood vessel and to anchor it. Let's look at the main differences between artery and vein structure. Arteries are round and veins are flattened, and one of the main reasons for this is the artery has a thick tunica media, while the vein has a thin tunica media. The artery has a smaller lumen and the vein has a larger lumen. The artery carries blood away from the heart. The vein carries blood to the heart. Arteries are under high pressure, veins are under low pressure. And arteries carry oxygenated blood and veins carry deoxygenated blood. There's one exception to this, and we'll talk about that later. In this diagram of the artery and vein, you can see some of the characteristics we just listed. If you look at the artery, you'll see the lumen is smaller and rounder than the vein, and the tunica media is thicker. Here is a microscope slide of the artery and vein. Again, look at those same differences. The vein is flattened, the artery is more round, the lumen of the vein is larger, and the lumen of the artery is smaller. You can also see that the artery has a thicker tunica media. These are both examples of arteries. You can see the small round lumen and the thick tunica media. Now compare the artery to the vein in this microscope slide. The artery is on the left, the vein is on the right. There are three types of arteries. Arteries are elastic, or muscular, or arterioles. You've probably already guessed, but elastic arteries are named such because they have many elastic fibers. Their tunica media has very few muscle fibers. Elastic arteries include the aorta and its branches, and they are large in diameter and therefore have very little resistance. For this reason, we call them conducting arteries. They exhibit passive rebound during diastole, so their blood pressure stays high, and we'll talk about passive rebound in just a minute. They are blood pressure reservoirs. That means they maintain blood pressure. This diagram shows you what the left ventricle looks like during diastole, or during relaxation. You can see also that the aorta is relaxed. Now compare that to what the left ventricle and aorta look like during systole, or during contraction. The left ventricle is contracting and forcing blood into the aorta, which expands because it's elastic. Now look at the left ventricle and the aorta early in diastole, or early in the relaxation stage. The aorta is elastic, and so it rebounds. As blood is forced through the aorta, the walls begin to contract, much like a balloon that's blown up and deflates. This is called passive rebound, and it keeps blood pressure in the aorta high. Muscular arteries are smaller than elastic arteries, and they are more distal to elastic arteries. That means they're farther from the heart. Their job is to deliver blood to the organs. The tunica media is mostly smooth muscle, which is why they are called muscular arteries. They are less distensible or less stretchable than elastic arteries, which makes sense. They are important in vasoconstriction as well. Arterioles are the smallest arteries, and their diameter is about that of 5 red blood cells. Their tunica media is mainly smooth muscle, and this is the reason they're able to control blood flow to the capillary beds. You can see the smooth muscle in the tunica media of this arteriole. The smallest of the vessels is the capillary. It is microscopic. Its diameter is slightly smaller than that of a red blood cell, which means as red blood cells pass through capillaries, they must distort slightly. The walls of capillaries are a thin layer of tunica intima. The capillaries allow exchange between the blood and tissues, exchanging nutrients and waste products. Networks or groups of capillaries are called capillary beds. All capillary beds cannot be open at one time because we do not have enough blood. So we open and close capillary beds as they're needed. It's the job of sphincters, which are smooth muscle valves, to open and close capillary beds as needed. This diagram shows you what happens when sphincters open and close capillary beds. In the capillary bed on the left, the sphincter is open and you can see blood coming from the arteriole, flowing through the capillary bed, and going out through the venule. On the right side, the sphincters are closed and there's no blood flow from the arteriole to the capillary bed. There are two types of veins, venules and veins. Look at the slide on the right and compare arterioles and venules. The arteriole has a much thicker tunica media than the venule does. Venules arise from capillaries and they're porous. They have all 3 layers. If you look in the slide on the right, you can see the endothelial cell, which is tunica intima, the smooth muscle cell, which is tunica media, and tunica adventitia to the outside of that. Veins arise from venules, and they have all 3 layers, the tunica intima, tunica media, and tunica adventitia. They're able to hold large volumes of blood for 2 reasons. They have thin walls, and they have very large lumens. And these 2 characteristics together make them more stretchable or more distensible. Because they can hold large volumes of blood, they're known as blood volume reservoirs. At rest, they can store about 60% of the blood in the body. In veins, the blood pressure is low. So if blood pressure is very low in the veins, how do we return blood to the heart? The reason we're able to do this is because of 3 special features of the veins. First of all, they have large lumens, so there's very little resistance. Second, they have one-way venous valves. These are valves that allow the blood to go through, but not to move backward. And third, skeletal muscle movement helps move blood. So this would mean things like walking and respiration. This handout shows the blood pressure in the systemic circuit. This handout is posted above the audio lecture on Blackboard. If you look at the movement of blood through the systemic circuit, you see we begin with the aorta. In the aorta and the arteries, blood pressure, systolic pressure, is fairly high. As you move on through the arteries into arterioles, it begins to drop. From the arterioles into the capillaries, it drops even more, and as you pass through venules, veins, and the vena cava, it drops down close to 0. Why is that? We'll look at the answer in the next slide. Here are the features you should know about the previous handout. First of all, where is the pressure the highest in the systemic circuit? And the answer is the aorta, where it's about 120 millimeters of mercury. What happens to pressure as you move through the system? And you should have seen that it does decrease. How much does pressure drop between the arteriole and the venule? This is after it passes through the capillary bed. And it goes, if you look back at the chart, from about 40 millimeters of mercury to about 20 millimeters of mercury, or by half. Where in the system is the blood pressure the lowest? And it's in the vena cava. So the question is, why is blood pressure lost as blood flows through the system of capillaries and blood vessels? And it's because there is resistance all along the path. Mammals have completely separate pulmonary and systemic circuits. Separate circuits have a number of advantages. One is oxygenated and deoxygenated blood cannot mix. So the systemic circuit is always receiving blood with the highest oxygen content. Respiratory gas is maximized because the blood with the lowest oxygen content and highest CO2 content is sent to the lungs. And when you have separate systemic and pulmonary circuits, they can operate at different pressures. One of the most important reasons that mammals have separate circuits of circulation is because pressure is lost when the blood passes through the capillary bed, and there are a lot of capillary beds in the lungs as well as other areas of the body. Once the blood passes through these capillary beds and loses pressure, it then needs to be repressurized, and that's possible when you have two circuits. Let's review a couple of points about pressure and resistance. The first question is, why does blood pressure stay high in arteries during diastole or during relaxation? And remember, the answer is because there's passive rebound in elastic arteries. And the second question is, how does blood get back to the heart through the veins despite the low blood pressure in veins? And remember, there are three things in place that help this to happen: one-way valves, the movement of skeletal muscles, and low resistance in veins. Varicose veins are veins that are permanently stretched. Most often the condition is due to incompetent valves. More women than men are affected by varicose veins. There are a couple of treatments. The most common treatment and the initial treatment is a compression stocking worn when the patient is up and around. The stocking will relieve some of the symptoms and delay the progression of the condition, but it does not cure the condition. The only definitive treatment to stop the flow of blood back into the legs is through surgery by surgically destroying the varicose vein. This diagram shows you the difference between a normal vein and a varicose vein. You can see the incompetent valves in the varicose vein. When valves are incompetent and blood pools, varicose veins are the result. The vein most likely to become varicose is the saphenous vein and its branches. The great saphenous vein is a large venous blood vessel running near the inside surface of the leg from the ankle to the groin. Along its length there are about 10 to 20 one-way valves that keep the blood from flowing back toward the foot. Here are some tips on how to prevent or at least slow down the occurrence of varicose veins. Be sure that you do not stand or sit for long periods of time. When you do, blood tends to pool. Lift your legs beyond the level of your heart. Avoid carrying things that weigh more than 10 kilograms. Exercise regularly. Check your calves each night and be aware of any lumps. Do not smoke, and this is good for many different reasons. Keep your legs elevated 15 centimeters when you sleep at night. And massage is always a great way to improve circulation. There are a number of factors that contribute to varicose veins. They include heredity, prolonged standing, obesity, pregnancy, and elevated venous pressure like straining during childbirth. In both pregnancy and obesity, pressure on the groin and venous return is restricted, and that's the problem. Varicose veins and spider veins are similar, but they're not the same thing. Spider veins are much smaller, and they are usually blue or red, and typically located on the legs and face. It's very important to have a physician check varicose veins on a regular basis. The problem is, left untreated, varicose veins can cause complications like skin ulcers, as you can see in this picture to the right. Here are before and after pictures of varicose and spider vein sclerotherapy. One other treatment sometimes used in varicose vein and spider vein treatment is sclerotherapy. It's a medical procedure that involves the injection of a solution, usually it's a salt solution, right into the vein. The solution will irritate the lining of the blood vessel and causes the vessel to collapse and stick together, and the blood will clot. Over time, this vessel turns into scar tissue that fades away.